Neuromodulation is a new approach that tries to interrupt the pain signaling and the propagation of pain impulse through the nervous system by applying electrical stimulation at some point through the pathway to at least minimize the amount of pain generating impulses that goes up from whatever in the periphery through the spinal cord to the brain, where we sense the pain and formulate our response. Neuromodulation can be as simple as shaking your thumb when you hit it, when you hit it with a hammer, massaging your hands when it's in pain, massaging the muscles when they are in spasm, and that generates an electrical impulse that goes to the interception between the peripheral nerve and the spinal cord and reduce the impulse propagation at that level. This can be delivered by what we call the TENS machine, which is something that you can buy from pharmacy, and you apply pads onto the painful area, and that can be used to generate some electrical current through a battery powered machine. And this electricity again produces some electrical current that goes up to the spinal cord and tries to intercept and intervene with the propagation of impulse from the peripheral nerves to the spinal cord that goes into the central nervous system. Now, we, over the past 3 decades, developed a new way of delivering these electrical impulses in order to interrupt the propagation of pain impulse by the means of implanting an electrode into the epidural space, which is the space surrounding the spinal cord, at the needed level where we need to interfere with the impulse progression. And this lead gets connected to a power generator, a battery, that generates some electrical current that gives constant electrical impulses into that electrode. And that's how we provide a mean of mimicking the shaking of the hands, the massaging, or the TENS machine at a much higher intensity and efficacy to achieve a reduction of the pain progression through the spinal cord. This is called the spinal cord stimulator. And the spinal cord stimulator over the past 10 years became a well-established mean of trying to control peripheral pains. Now, beyond that, the new technology is aiming to do that interruption of impulse at peripheral nerves as well. And now there are what we call peripheral nerve stimulators, where instead of going into the spinal cord territory in the epidural space, you can put the electrode next to the peripheral nerve in a much less risky intervention and provide this electrical current that interrupts the pain progression originating from that nerve itself. And this is called peripheral nerve stimulation. There are problems and central pain processing problems that won't benefit from those two approaches. Instead, it may benefit from what we call deep brain stimulation. And it is a progressing technology that hopefully will have a much wider scope of use in the near future. The implantation of the neuromodulating tool is done through a surgical and mini surgical intervention. To start with, the rubbing of the hand or the shaking of the thumb or the TENS machine or the massage. These are all examples of non-invasive neuromodulation techniques. But when we talk about the real meat and the actual implantable neuromodulation technology, we are talking about a small surgical interventions, a mini surgery where an electrode is inserted into the area of interest. The most common place is the epidural space, and this gets connected to a battery like a pacemaker, a small battery-powered rechargeable device that gets implanted under the skin. So it is a mini surgical intervention to try and implant those neuromodulatory devices. And then this device will work continuously. It may need recharging through the skin using special chargers, but it will continue to work throughout the months and upcoming months and years after the implantation to try and achieve this interception of pain impulse at the spinal cord level. The main indication for neuromodulation is persistent neuropathic pain. And the commonest example of this pain is what we call CRPS, complex regional pain syndrome. Any intractable peripheral nerve pain relating to spinal cord injury or fibrosis after surgery, that is the second commonest indication for the use of spinal cord stimulator. It's finding its use in much wider scope of pain problems, but because of the difficulty in obtaining clinical evidence and long-term use efficacy, it's not yet mainstream treatment options for other pain conditions, but it has been shown to be effective even in migraine, in peripheral nerve injury, in chronic intractable lower back pain that is resistant to other interventions. And so the scope for benefit from those neuromodulatory tools are vast, yet because of the slow progression of obtaining evidence, these are the commonest examples where you find neuromodulation useful. If we apply the right technique to the right patient, and if we are careful in selecting patients for such a treatment, the scope of success is quite vast, and the chances of improving pain, functionality, and quality of life is very high. So if you start by selecting the right patient for the right approach, then the success rate is quite high.